Today I am going to talk about pericoronitis. Peri means around. Corona means crown. Definitely I am not talking about coronavirus. It's a crown of tooth only. Now finally, itis means inflammation. So pericoronitis actually inflammation around crown of tooth. So let's see what is the definition of pericoronitis. Pericoronitis refers to inflammation of the soft tissue in relation to the crown of an incompletely erupted tooth, including the gingiva and the dental follicle. So it's an inflammation around the incompletely erupted tooth. Let's see its clinical representation. Though pericoronitis can be seen in any tooth, but it is most common in mandibular third molar. You can see the unerupted mandibular third molar and the overlying gingival tissue, the inflammation of gingival tissue. It's classical representation of pericoronitis. The periodontal flap overlying an unerupted tooth or partially erupted tooth is called operculum. So pericoronitis is also known as operculitis. Now classification. Pericoronitis can be classified as acute pericoronitis or chronic pericoronitis. Now what is acute pericoronitis? That means symptom must be acute. So what are they? It should be sudden onset. It should be short-lived but having significant symptoms like redness, swelling, inability chewing, redness, difficulty in mouth opening. Acute pericoronitis also having some systemic involvement like headache and fever. Now, acute pericoronitis is also related to very poor oral hygiene. Now, chronic pericoronitis or recurrent pericoronitis. What is that? Repeated episodes of acute pericoronitis occur periodically. It may cause few symptoms, but some signs are visible at the time of intraoral examination. The chronic type mostly seen with good or moderate oral hygiene. That means, in case of chronic periodontitis, the symptoms may be little less than acute pericoronitis, but it is repeated. And the signs like bleeding, like pus formation, that can visible at the time of intraoral examination. Factor. First and foremost is the presence of any impacted, partially erupted or unerupted tooth and presence of periodontal flap. In this picture you can easily understand this is mandibular third molar impacted, this is operculum, and this area is periodontal pocket, and that is a representation of pericoronitis. Now other risk factors other than impacted tooth and periodontal pockets are opposing tooth. Now opposing tooth constantly irritates the overlying gingival tissue of an impacted or partially erupted or unerupted tooth. So this can be a risk factor. Others is poor oral hygiene, respiratory tract infections and tonsillitis, prior history of pericoronitis. So these are the risk factors of pericoronitis. So let's move on to etiology. Etiology is very easy. This is unerupted tooth, this is other tooth, this is occlusal line, this is overlying periodontal flap or operculum. Every time we chew or eat something, food gonna lose this area, and if you don't clean this area or this area sometime very inaccessible, so food lodgement can create a very good environment for bacteria. So this area subsequently get inflamed due to food present here, bacterial involvement. This area will inflamed, will swell, will reddened, and other features of it. So the main cause of the pericoronitis is the presence of this operculum, and food get lost here, bacterial involvement, uncleaned surfaces. That is the reason actually. Now let's move on to next topic. It is what are the clinical features of acute pericoronitis? Redness, swelling intra or extraoral, suppuration, throbbing pain radiating to ear, throat, floor of the mouth, TMJ, mandibular, posterior submandibular region. Pain while biting. Pain may disturb sleeping. Dysphagia, that is difficult in swallowing. Trismus, that is difficult to mouth open. Fever, malaise, regional lymphadenopathy, loss of appetite. These are all features of acute pericoronitis. In severe case, infection can extend to tissue spaces. I'll discuss later on what will happen when infection extend into tissue spaces in complication part. So chronic periodontitis, the clinical features are dull pain with mild discomfort that lasts for a day or two, with remission lasting for many months. An area of ulceration may be associated with chronic pericoronitis, may resemble necrotizing ulcerative gingivitis. Patient may also complain of a bad taste. Now, what are the microbial flora present? Actually, mixed bacteria present here. It's sometimes similar to periodontal pocket microbial flora or dental plaque flora. Most common are Streptococcus, Actinomyces, and Propionibacterium species. And other bacteria are beta-lactamase producing bacteria such as Prevotella, Bacteroides, Fusobacterium, Capnocytophaga, and Staphylococcus species. It is proven that the microbial flora of pericoronitis are predominantly anaerobic. Pericoronal flap colonize the same bacterial species which are seen in tonsillitis and periodontitis. Next histological feature is an inflammatory lesion. So you can see histologically epithelial hyperplasia. Epithelial hyperplasia you can see. Next, what can be inflammatory lesions feature? Infiltration of profuse amount of lymphocytes, plasma cells, okay, neutrophils. So profuse infiltration of lymphocyte, plasma cell, neutrophil, epithelial hyperplasia, and intracellular edema. So these are the features. First is epithelial hyperplasia. Second is intracellular edema. Third is profuse infiltration of plasma cell, lymphocyte, and neutrophil. So this is the features of histology. Next, complication. This part is very important. Pericoronitis may lead to more serious problem when left untreated. If condition is localized, it may convert into pericoronal abscess. You can see the partially erupted tooth and the pericoronal abscess around it. If infection is localized, that can happen. This is the pericoronal abscess location. If infection doesn't remain localized, then what can happen? It may spread posteriorly into the oropharynx and medially to the base of the tongue. Hence, there is presence of difficulty in swallowing. Depending upon severity of the condition, there is an involvement of the lymph nodes. It may be submaxillary, posterior cervical, deep cervical, and retropharyngeal group of lymph nodes. In case of more widespread infection, you can expect tissue space infection. From mandibular third molar pericoronitis, masseteric space, pterygomandibular space, buccal space, sublingual space, retropharyngeal space can get infected. So if I say what is the sequelae of pericoronitis, in case of severe condition, you can expect peritonsillar abscess, peritonsillar abscess. Next, number 2, cellulitis, and in case of dangerous situation, infection can spread to the bilateral submandibular space, lingual space and sublingual space and submental space. That is called Ludwig's angina. That is the most severe case. Ludwig's angina, the clinical representation is stony hard tongue, swelling at the base of the tongue, swelling at the submandibular, sublingual, submental region, and it will lead to breathing difficulty, fever, severe pain. In case it left untreated, the sequelae can be go to the death also. So you have to be very specific about managing this situation. Now, the management of pericoronitis. So this is presentation of pericoronitis. This is operculum. This is impacted tooth. This is operculum, and food get lost in this area. So first line of treatment is irrigation with saline, warm saline irrigation with saline or chlorhexidine or povidone iron. You have to irrigate that area. In case of inaccessibility, when your irrigating solution is not getting reached to this area, you have to raise the flap. With scaler or curette or any hand instrument, and you have to curette this area. And you have to swab with this area with chlorhexidine. So second, elevation of flap and curettage and swabbing. Next, in case of severe condition or in case of any systemic involvement is there, you have to prescribe oral antibiotic. Like amoxicillin, amoxiclav. In case of allergy to amoxicillin, you have to give erythromycin, and you have to prescribe also chlorhexidine mouthwash. In case of severe condition like in tissue space infection or in case of involvement of lymph nodes, you can go into IV antibiotic also. And lastly, you have to motivate the patient that these areas should be maintained very carefully. But in case of chronic infection or repeated attack of pericoronitis, or you can say recurrent pericoronitis, you have to think about extraction of the tooth. Sometimes it is very difficult to clean an inaccessible area. So in that case, when a repeated attack of pericoronitis is happening and patient is not maintaining the oral hygiene properly, and he or she is having difficulty of maintaining that area, you have to go for extraction. So treatment: irrigation, elevation of flap and swabbing, oral or IV application of antibiotics, painkiller, then mouthwash like chlorhexidine, and lastly extraction. So thank you guys. I think you enjoy this topic. We'll see you in next video.